Good afternoon, and welcome to our 13th virtual town hall devoted to 2020 and 2021 planning activities here at Johns Hopkins University. I'm Stephen Gange, Professor of Epidemiology at the Bloomberg School of Public Health, Executive Vice Provost for Academic Affairs, and one of the co-chairs of the COVID Task Force Steering Committee. I'm delighted to be moderating this session with 6 of our distinguished university leaders: John Links, Professor, Vice Provost, and Chief Risk Officer; Tom McDermott, Assistant Vice Provost for Financial Aid; Smita, Ruzicka, Dean of Student Life; Kevin Schollenberger, Vice Provost for Student Health and Wellbeing; Alanna Shanahan, Vice Provost for Student Affairs; and Andy Wilson, Dean for Academic and Student Services. This Monday, you received 2 messages about spring planning. One from President Daniels, Provost Kumar, and Vice President Miller regarding a broad set of planning across the institution, and one from Vice Provost Shanahan and myself focused on undergraduate issues. The goal of today's town hall is to provide additional information about the undergraduate experience, as well as to address your concerns and questions. A broader town hall that will focus on other parts of the institution, including graduate schools, is scheduled for Monday, November 9th at 11:30 a.m. In our announcement for this session, we asked you to send us questions beforehand and have appreciated the many that we've received. Below this screen is a box that will allow you to send questions in real time. We will answer as many of those submitted as we can. Like our other sessions, this town hall is being recorded and will be available for asynchronous viewing. We will also work to use the questions that we've received to expand our FAQ documents for the website. Let me start by talking about academic planning. As noted in our messages, we are planning to resume in-person, on-campus academic and residential offerings this spring to the greatest extent possible. The messages that we've sent out and this town hall outline the parameters of our plan. Many details were prepared as we were expected to return to fall. We are updating and expanding those details and in our phase 2 return to campus guidance documents that will be released in December. We made this announcement knowing that this is but a plan, and we are highly dependent on the public health situation. We are monitoring the health conditions both here in Baltimore and nationally very closely. And we have been learning a lot over the course of the fall. We have been learning from our on-campus research activities. And while we have not had any in-person instruction in any major fashion on campus, Johns Hopkins has been open, and we have had extensive research activities ongoing since June. These have been undertaken with care, including strict protocols managing density, masking, and distancing between persons in the lab. Further, we have been talking with our peers who have brought back students in person for the fall semester. We've been learning from those who have been successful at holding the virus at low levels in their community, as well as from our peers who have struggled with outbreaks. 4 important data elements have emerged. First, neither we nor our peers have seen any COVID transmissions occur in our research environment. Our success in this area has contributed to our recent announcement 1 week ago that expanded the number of individuals that are permitted in laboratories and expand and open up some additional access to individual offices. Second, none of our peers have reported seeing transmission in their in-person instructional settings. The protocols for health and safety that they're using are fairly in line with what we are planning for the spring. Third, preparations for COVID cases is vital. No one wants cases to occur on campus or within their community, and we're working hard to prevent this. But we also recognize that we have to be prepared to respond if they do occur. and you'll hear soon from John and Kevin about the additional preparations that we're taking with regard to health and wellness. Lastly, the importance of the commitment by all members of our community is important. Many of you know that this fall, our Student Advisory Committee put together a student compact that called upon each of us to take communal responsibility for a variety of practices that we expect on campus, no matter if we're on campus or off campus. And I'm delighted to report that the faculty and staff are equally enthusiastic about such an approach, and we're working on a university-wide compact now. We've said that we would make a determination in January, if not sooner, about whether our plans for the semester can be carried out safely or will need to change course. The degree to which we are dependent on the variety of aspects that may occur may heavily influence our plans, either to continue, to delay, or to pivot entirely. We will certainly keep you involved and informed as we make these determinations. Let me next turn to several issues regarding academics. As you've seen, courses will be offered in mixed modality. Our in-person courses will be limited in size and be conducted in physically distanced environment. We were planning to do this for fall, and we have been updating our planning and rooming so that all of the in-person activities will take place in spaces where there is clear distancing and expectations for students to be protected in that environment. One new thing that you will see is when you are searching or registering for classes now in our student information system is a description of the instructional delivery modality for each class. The faculty and dean's offices have worked hard to capture this to ensure that each student, when they're registering, will have an understanding of what the modality that the course will be offered. We've highlighted that students are not required to come to campus. Students may remain remote for the spring semester, and we anticipate will be able to maintain their academic progress. To the greatest extent, all of our in-person courses will have remote options for those students who may not be returning to campus, as well as those who may not be able to get to campus. There may be a small number of classes that can only be delivered in person, and these will certainly be clearly noted in the spring schedule. It's also important to recognize remote and online options will be a significant part of what we're offering. And there may be students who still come to campus who continue to have some or all of their classes conducted remotely. We are aiming to have the spring schedule live this Monday, which will be before registration begins for seniors next Friday, November 13th, and the following week for other students. We actually received before this session a question about how we would ensure students who choose to learn remotely are getting the roughly the same experience as students who choose to return to campus. And as we've communicated since this summer, both to students as well as to faculty and TAs, we expect optionality during the course of the pandemic. We've held a variety of training sessions for faculty and TAs, some of which have specifically targeted mixed modality teaching. We've also invested significantly in technology within our classrooms, including 35 newly created learning studios that are enhancing online instruction. So we believe between all of these measures, as well as the fact that we are using our core faculty in teaching, that they will be able to get the learning objectives for each of the class. I should also mention, we've also continued to monitor this through surveying students and ask them, do you believe that you can achieve the learning objectives for the class through your modality? And the vast majority of them have said they could. We will continue to monitor this through the spring. In-person research opportunities will be available to undergraduates. The way that we have undertaken research over the last several months has been in a very careful and planned manner. Individual principal investigators put together plans for how their labs will run. And those that who want to and will be able to accept undergraduates will be asked to modify those plans and work with their dean's offices so that any undergraduates who are brought into in-person setting, laboratory research setting will be protected as with the other members of the lab. As always, remote opportunities for research will continue to be available. As hopefully you've seen, we've made some changes to the academic calendar. We plan to start the semester as usual on January 25th and end as planned. Instead of a week-long spring break, what we have planned is for days off to be scattered throughout the semester with 2 3-day weekends and other break days built into the schedule. Similar to what many of our peers have done, our goal with this change was to disincentivize travel. And we considered several different options. One of the options was just delay the term and start a week later and continue as normal. But I think everyone recognized the value of break days, and our planning teams and leadership all entirely agreed that a better approach would be to build these break days into the calendar. They're scheduled to occur in the latter half of the term, consistent with the type of breaks that are scheduled in the fall. And the dean's offices have pledged to work with faculty to ensure that additional work is not assigned during these times, and they are treated as other breaks. Just in terms of a couple other academic issues, the suspension of university-sponsored undergraduate travel will likely continue. In addition, the outgoing undergraduate study abroad program has been suspended for spring of 2021. And lastly, let me just say a few words about international students. We are working under the assumption that the current Student Exchange and Visitor Program, or SEVP policies that are currently in force will continue. Hence, we are working under the assumption that with the strategy that we've outlined, new and continuing undergraduate students will be able to be issued visas for travel to the US under our plan. We recognize that COVID travel restrictions continue for some countries, and that consulates are not back to full capacity, and it may not be processing at levels as in the past. And given that each student's situation is unique, we highly encourage each of you to keep in contact with advisors at the Office of International Services for the most up-to-date and personal information. So with that, let me turn things over to John and Kevin to discuss health and testing. John, can we start with you?
You bet. Hello, everyone. So I want to start by reminding everyone that we continue to use all 3 possible uses of testing. That's medical management, epidemiologic surveillance, and mass testing of asymptomatic persons. So right now, anyone who has symptoms calls the Johns Hopkins COVID call center, the JHCCC, and there's a intake interview, and those who require it are referred to testing, and the person is followed through the entire process of return of test results, clinical management, and if the person's positive, contact analysis and notification. We are right now on the Homewood campus doing an epidemiologic surveillance study of roughly 330 undergraduates, graduate students, faculty, and staff who are on campus, who get tested multiple times a week, and that is occurring during the entirety of the fall semester. Finally, we are already doing a limited amount of mass testing of asymptomatic persons. We're testing everyone who lives in the dorms right now, and we're going to be expanding that testing. But the big news is we're going to be greatly expanding that testing for the spring semester. So first and foremost, in the spring, testing will be available at no cost for anyone who wants it on a weekly basis. The tests will be saliva-based, but it'll still be nucleic acid testing with PCR analysis. So it's the Cadillac model in terms of what we're testing. There will be multiple sample collection sites set up, both on the Homewood campus, more than the Shriver Hall location we have right now, and on other campuses as well, including Peabody, Carey Business School, and SICE in DC, as well, of course, as in East Baltimore. So everyone who wants a test on a weekly basis will be able to get a test at no cost. In addition, all undergraduates living in the Baltimore area, whether they are coming on campus for classes or other activities or not, will be required to be tested twice a week. All graduate students, postdoctoral fellows, faculty, and staff who are interacting with students will be required to be tested once a week. Additional folk may be required to be tested as identified by each school based on local circumstances. So for the spring, we're planning a greatly expanded mass testing program for asymptomatic persons based on saliva with a combination of mandatory and voluntary testing. Let me talk a little bit about compliance with both that set of requirements for those for whom testing is mandatory, as well as the daily health screening that is required for anyone coming on campus, the flu shot, which is required to have been obtained by November 20th for anyone coming on campus after November 20th, and that of course includes for the spring semester. All of that will be handled via an application developed at Hopkins called ProDensity that you can download from the App Store for free. ProDensity will do the daily health screening, but it will also be fed information from other systems that are tracking flu shot compliance and mandatory testing compliance. And the app issues a green pass or a red pass, depending on the combination of daily health screen, flu shot, and mandatory testing fulfillment. So we will be very actively monitoring compliance, and students and employees who do not have a green pass each day will not be permitted access to buildings on campus. With that, I'm going to turn it over to Kevin to add some more detail.
Yeah, actually, maybe before Kevin starts, given that there are a couple of questions related to those issues, John, the payment of the test, just to emphasize, is not related to student insurance whatsoever, correct?
No, we are offering these tests for free at no cost to all affiliates, and you're not filling out paperwork and getting reimbursed or anything like that. We are just straight up covering the costs of the test.
Great. Thank you. I just wanted to clarify that. Kevin, do you want to speak about some other health issues now?
Sure. Thanks, John and Stephen. And John had shared how we are expanding our mass testing of asymptomatic students. I just want to reiterate something John already said is around the services and testing we have for symptomatic students. So students who are feeling ill or may have had exposure to someone who has tested positive. Hopefully most of you know we set up the JHCCC, or students now are affectionately calling it the JAC. That will continue. It's open 7 days a week. And like John said, we have clinicians there who will advise students on their next steps, help them order tests. They will share the results with the person. And if the student tests positive, we'll advise them on next steps, which could include isolation, housing, or quarantine. They'll also work very, this is the JHCCC is staffed by both health system clinicians as well as our student health and wellness staff. And our student health and wellness staff will do daily health checks for our students who tested positive, mostly through a telemedicine platform, but are prepared if they do need to see students in person. So I know there was a question about kind of level of care. We also, some of you may not know that we set up a symptomatic sample testing tent at 3101 Charles Street to make it more convenient for our students who are feeling ill to be tested. In the spring, they were going to our East Baltimore tent, so they no longer need to do that. We have one right here in Charles Village. And we also opened a satellite health clinic also at 3101 so that we could see sick patients. And part of that was we are also still seeing students in our regular health center for things like allergy shots and other kinds of things. And so we wanted to make sure we separated students who may be COVID infected from other students when we're offering medical services. As we shared in the announcement, the university is providing space for isolation. So that's for students who tested positive, and quarantine housing. So students who have been exposed to someone who's been positive, for all students who live on campus. For students who live off campus, if they do test positive, when they're having a conversation with our medical providers, if it's determined that they're in a housing situation where they may not be able to adequately isolate, we will work with them and student affairs to also provide them on-campus isolation housing. So we have set that up, and I'm sure Andy and Alanna will say more. We've also partnered with student affairs that, in addition to regular medical checks and making sure that we're providing the medical care that's needed, will be taking care of their other needs, such as dining and other services, which Alanna and Andy will share. I know that was one of the questions. I do wanted to share in general, our student health and well-being provides a range of services from primary care to mental health to overall wellness programs. We have been providing those throughout the fall. We have a very robust telemedicine and teletherapy offerings in place. We will continue that in the spring, but we will also see students in person in those clinics for certain types of exams that would need kind of more in-person examination. But we are not doing walk-ins. So we do ask students that they call the counseling center or health center, and they can work through with their physician if it can be done through a telemedicine platform, or if they can come in. And I do want to promote, we did offer additional mental health services, such as Timely MD, which has a 24/7 Talk Now, as well as those students who decide not to return to Maryland and Baltimore will continue to have access to counselors in their states. So that will be continued through the spring. Just a few other quick things. We changed the waiver requirements this fall for our student health insurance. So normally international students who are on an F1 or F2 visa are required to have our health insurance and are not able to waive. For the fall, we said if you were studying outside of the US, so you were doing your studies virtual outside of the US, you could waive the health insurance. If you plan to come back to Baltimore or Maryland, you will need to sign up for that health insurance. We also allowed United States citizens who weren't returning to Maryland or DC in the fall, but were just covered in their state to also waive the insurance. So similarly, if you are coming back to Baltimore and Maryland and your current health insurance does not cover care in the Maryland area, you will need to re-sign up for that insurance. And we'll send out more detailed information to all of those students who've waived so they can reassess if they need to sign up for that insurance or not. And then I can't emphasize enough what John said about the flu shot. So just from a public health point of view, we're actually encouraging everyone to get their flu shot, regardless if you're coming to campus or not. We just think it's an important thing to do to protect your health. But like John said, any of you who are planning to come to campus and participate in any campus activities are required to get the flu shot by November 20th. We tried to make it as easy as possible for you to get it. So if you have a Walgreens in your area, you can download a voucher. And you can find all this information on our wellness.jhu.edu site under the flu blog. You can download that voucher, go to Walgreens and get your flu shot for free. If you don't have a Walgreens near you, most insurances, including student health insurance, include the flu shot for free. So again, we encourage you to get it, but if you get it outside of the Walgreens, please keep your information and send that to our student health center so we have record that you got it. And then lastly, some of you may have pre-existing medical conditions that make you more vulnerable to COVID-19. Things like moderate to severe asthma or diabetes. If that is the case, we do encourage you to have both a conversation with the health center and our disability services if you plan to come back, so we can talk through if there needs to be some additional accommodations to make sure that you're safe in this process. Thanks, Stephen.
Great. Thanks, Kevin. Let me ask, there was a question that came in about quarantine requirements for freshmen traveling to Baltimore. Since you mentioned quarantine, do you want to take that?
Sure. So we are working out still kind of the details for both our quarantine and testing plan, and will provide more details beginning of December. But one of the things that we're looking at is asking students to be tested prior to arrival. They'll be tested when they also arrive. And this is both for on-campus and off-campus students, and that we are asking them to quarantine until they get a negative test result. John, I don't know if there's any more that you want to add, but we'll be sending out more details no later than December.
And obviously, if the state of Maryland or the city of Baltimore impose certain quarantine requirements, for example, travel from certain states to the Maryland or Baltimore area, we will honor those requirements as well.
So that ties to another question, which, you know, I alluded to about, is the spring in-person schedule the final decision? Right. And, you know, this relates to, you know, our readiness, both from a public health standpoint, as well as being consistent with civic authorities. Do you want to talk briefly about that, John?
Sure. So in releasing our multi-phase plan in the spring, we very intentionally meant to separate out what the operating posture would look like in a given phase from whether or not we would be in that phase at any point in time. So I'm about to say something you don't want to hear, which is we are absolutely planning as though we will be in phase 2 of our plan come spring semester. And all of our plans that we have described to you and will continue to describe to you are based on a phase 2 operating posture. But if all heck breaks out with the pandemic at the beginning of January, for example, we will not necessarily be able to enter phase 2, and therefore the spring semester will not look like what we're describing right now. And so we are planning like crazy so that we are prepared if public health conditions warrant that we will be in phase 2. But we will not know until a lot closer to the start of the spring semester whether or not those public health conditions warrant us moving into phase 2 or not.
Thanks, John. A couple other questions that came in relevant to this section. Someone asked about testing numbers, and in particular, total positive tests and test rates, whether they're made public. Do you want to talk about our efforts along those lines?
Yes, so we right now have a public-facing dashboard that gives results in aggregate for the university. We are making a significant number of enhancements to that dashboard right now so that we're going to be able to show the data in much more granular format. We hope to be able to release that in the next 2 to 3 weeks or so. So certainly by the time we hit January, we're going to have a very robust public-facing dashboard that gives all of those numbers in some detail.
Another testing question about whether students needed to be tested if they're attending remotely.
So undergraduates who are in the Baltimore area, whether or not they're coming on campus, will need in the spring semester to be tested twice weekly, which means they'll come on to campus twice a week to have samples collected for testing.
All right, let's see, a couple other related questions. One about the flu shot. So are students who are currently not on campus able to download the Prodensity app to verify if their flu shot documentation was accepted or uploaded?
The answer is yes. Anyone can download and use the Prodensity app, and it's free. And the flu shot is tied into it. I want to just give everyone a heads up that right now, the processing time to register a flu shot in the system that's behind Prodensity is on the order of a week or so. So if you got a flu shot yesterday and today the Prodensity app is telling you you haven't yet gotten your flu shot, don't panic. If you got it 2 weeks ago and the Prodensity app is still telling you you haven't, then you should reach out to us.
And if I can just add to that, Stephen, I want to make sure I got the question. I think also the question was they did send in their information that they got the flu shot and haven't gotten a confirmation. We were looking to do those confirmations closer to the November 20th deadline.
So if they haven't, like submitting ballots, if you haven't gotten anything, wait, you will get a response.
Yes.
Yes. Okay. There's another question for the freshmen taking a test before they're given their key. How long does it take to get results back, and how should they plan for that?
So taking a test, we've discovered, isn't a particularly specific way of expressing things, and we've been as guilty as anyone of talking about getting a test. So the test really, of course, has two main components: collecting the sample and then analyzing that sample for the presence or not of coronavirus, and having the results show up in the electronic health record, EPIC. We expect that in almost every case, the results will show up in EPIC within 24 hours of the sample being collected. What we are requiring is the collection of the sample before you're handed the key for a residential student.
Right.
And then what you will do is quarantine until you get the negative test result back.
Right. Within housing, you don't have to make other arrangements. Okay. Thank you both. And that's actually a good segue to Alanna, Andy, and Smita to talk about aspects of student and residential life. So Alanna, do you want to speak first?
Great, thanks, Stephen. And just a few introductory comments before I turn it over to Andy and Smita. But just wanted to highlight a few things. We've had a few questions around facilities. Again, our hope is that the majority of our facilities that service students will be open come spring, but clearly in a highly de-densified manner. So I know there was a specific question around the rec center. We anticipate the rec center will be open come January, and that we actually have engaged with technology for students to actually, in essence, reserve a space in the rec center. So we're hopeful that that helps manage student interest in the space. We don't have lines out the door for people waiting to access the facility. So expect the rec center to be open, again, de-densified, but also with some technology assistance as far as how you manage your ability to access the rec center. Same with spaces like the library and Brody, many of those spaces that our students treasure. The expectation is that they will be open, but again, with significant protocols around de-densification as well as cleaning and the like, and likely some at reduced hours to allow for that cleaning process to take place. So just wanted to mention issues related to facilities. Also do want to mention we have a large temporary structure that's being constructed on the freshman quad that will basically accommodate about 100 to 125 students in a de-densified manner. So our hope is to utilize that facility for either dining overflow or study space, depending on what's the highest priority at the moment when we hit January. But we'll have plans for that space to be utilized for either. Our hope is also, again, within the context of our dining halls, and Andy will touch on this, that we'll be well positioned to either be in a grab and go format or a de-densified seated format. So more on that from Andy. I think the one other piece I just wanted to touch on was just travel. We are asking our undergraduate students to register their travel with us. Again, appreciate we are strongly discouraging any non-essential travel. So we're really hopeful that our undergraduates, whether you're living on campus or in Charles Village, choose to basically stay put and stay with us the duration of the semester, but appreciate that emergencies do arise. And what we're asking is that emergency travel that you're doing on a personal level, that you register with us so that we can ensure that as you return to campus, we can provide the right supports. So for many of you, that will likely just be, a test immediately upon return and self-quarantining until that test result comes back. Obviously, if Maryland moves to stricter guidelines around out-of-region travel and requires a 14-day quarantine upon return, again, that's another space where we would want to assist you with managing that 14-day quarantine. So again, just wanted to put that out there now. We will ask that you register your essential travel with us. And again, we'll still strongly encourage you to consider staying with us and not taking any non-essential travel. I think that's likely it, Stephen. Are we ready to turn it to Andy?
Yeah, that'd be great. Thanks, Alanna. Andy?
Yes. Thanks, Stephen. Thanks, Alanna. I'm excited to talk to you about our plans for on-campus housing, dining, move-in, and new student orientation. For on-campus housing this spring semester, we have planned to reduce the density of on-campus housing from approximately 2,700 students to approximately 1,400 students. Each student will have a private bedroom, and no more than 2 students will share a bathroom in apartments and suites. And our community bathrooms, which are found in AMR 1, 2, and Rogers House, will be limited to no more than 3 residents sharing a set of fixtures. And those students living in those buildings will be assigned to specific bathrooms and a set of fixtures. So we're taking our COVID-19 guidelines very seriously, and this de-densification will certainly be coupled by additional cleaning that will take place each day in our residence halls, with special attention to the high touch areas such as door handles and elevator buttons. We'll also limit the occupancy in our elevators and in our hallways. And unless public health conditions change, only residents of a particular building will be allowed into that building. Yesterday, our housing applications process opened for first and second year students. These students will be able to select their housing preferences through this application process and provide roommate information. Students must complete this application process by next Tuesday, November 10th at 10 a.m. Eastern Standard Time. And students will receive an update on the status of their housing applications on Thursday, November the 12th. And then on December 2nd, they'll find out their final room assignment. So they'll know about their status for housing just a couple of days after they complete the application. We feel good about the 1,400 spaces that will accommodate our students because we looked at the student intention survey that more than 99% of our new students responded to, and over 93% of our second year students responded to. So we use that survey data to really help us understand the demand that we can expect. And we're still opening it up to all first and second year students, but we're going to prioritize our new students, our first year students and sophomore transfer students, and our second year students who provided their intention to live on campus or in off-campus JHU managed properties. They'll be prioritized right after the first year students in case the demand outpaces the supply for our on-campus spaces. And if that happens, students would know that we may not be able to provide them with an on-campus space on November 12th. And along with that notification would come ample support by our off-campus housing office to help them identify alternative accommodations. And while our current data suggests that this is an unlikely scenario, we want to be transparent and quick in our response to our students. And actually, any student who is planning to live off campus should take advantage of a series of workshops that are currently being offered by our off-campus housing office. These workshops are for students and families, and they begin this week and they continue through the end of the month with our virtual off-campus housing fair on November 24th. You can find all this information on the off-campus housing website. Along with the housing options, we have worked hard to plan for the de-densification of our dining facilities and to set them up in ways that adhere to CDC and university guidelines. We are planning to have and will have multiple dining facilities open. FFC, Nolan's, Levering, Charles Street Market, all are facilities that will feature grab and go service unless public health guidelines allow for limited seating. The grab and go dining sounds a lot like cold sandwiches in a brown paper bag, but please know that we will continue to uphold our high culinary standards to provide students with a well-rounded, healthy, hot, and delicious meal. Our dining offerings will also continue to include our kosher, halal, vegan, vegetarian, gluten-free, nut-free options, and basically our ability to accommodate our students who have dietary restrictions. We've also planned out the facilities and layouts that uphold the public health standards, and all our dining staff have been trained on additional sanitation methods and the use of cleaning and sanitation products, and they're screened daily for wellness and utilization of PPE. So these new safety and directional signs will help our students. They're also helping our staff navigate the dining halls and to stay safe. So along with the modified housing and dining, we've also redesigned how move-in will happen in the spring to adhere to public health guidance. In a typical move-in scenario, we accomplish move-in in just a couple of days. However, given the need to de-densify our campus and the residence halls in particular, we've elongated the move-in timeframe, with move-in planned to start on January 16th and continuing through January 24th in advance of the start of classes on January 25th. In mid-December, residential students will be able to log on to the housing portal, the same place that they have applied for their housing assignments, and they'll be able to sign up for a specific move-in day and time. And on that selected move-in day, as John alluded to, they'll arrive on campus, go through COVID-19 screening prior to receiving their residence hall key, and then they'll be able to move into the residence hall. Now, due to public health guidelines, we can't provide our typical amount of moving assistance. However, we will be providing large bins for students to move their belongings into their room. And we encourage all our students to pack lightly for the semester to make that an easier process for themselves. And again, unfortunately, due to the public health guidance, only students who reside in the residence halls may enter, including family members. So moving beyond just meeting students' basic needs with their housing and dining, I want to talk a little bit about how we help them create their sense of belonging through our new student orientation program. Kind of regardless of their decision to engage in person, we will continue to provide robust engagement and support throughout the spring semester. Given that the first year mentor role has been a consistent upperclassmen peer-to-peer mentoring presence since July, they'll continue this during the spring semester, regardless of students' modality. They'll be focusing on forming and maintaining peer social connections, and FYMs will remain a constant in the lives of new students during their first year. We imagine FYMs facilitating small group meeting in person to deepen those peer-to-peer relationships, as well as orienting those students who come to Baltimore to our campus in Charles Village. Of course, for those who choose to remain at home, FYM groups will continue to meet virtually, and FYMs will continue to play a positive role in their experience. Certainly more details to come on the exact schedule for new student orientation, and a lot of this information is on our housing website. So at this point, I think I should turn it over to Smita. If there's any questions that have come in, I'm happy to help.
Thanks, Andy. So since you mentioned dining, I'm sure there are possibly, parents who are concerned if their student, does have to go into quarantine or isolation, what will be provided to them. I think, we've certainly seen other university issues with regard to that.
Yeah, so we are laser focused on making sure that our students have, nutritious meals, especially when they are in a quarantine or isolation situation. So we have our partners in dining who have provided not only just meals as students are moving in, but giving them meal kits so that they have several days of food at their disposal. So we're certainly focused on that, and we feel like we'll be able to fulfill that easily.
Great. Thank you, Andy. Smita, do you want to talk a little bit about student organizations and other student life issues?
Absolutely, I would love to. Thank you, Stephen. Good afternoon, good evening, good morning to all of you in different time zones. I'm Smita Ruzicka. I serve as the Dean of Student Life for Homewood campus. And I would love to give you an overview of our thoughts, philosophies, and plans around student activities and larger student engagement and affinity building of all of our undergraduate students. So I'll also pick up a little bit on what Andy has talked about in terms of our residential experience as well as our first year experience. I want to start by first really giving a shout out to our current student organization leaders, our mentors, who this semester have really helped us in delivering important programs, events, and connected experiences for our students. This semester has proved a wonderful way for us to learn about what our students need and how we can engage with them in a virtual platform. As we make this pivot to the spring semester and have a larger number of our students on our campus in our residential spaces, I think one of the key pieces I want to put out there is, especially in terms of activities with our students and our student organizations, we will still continue to really look to the virtual world for many of those activities. While we will have more students on campus, we have to balance our student activities and student engagement plan that with a balanced approach to public health guidance, the health and safety of our students, as well as equally focus on how do we make sure our students feel connected and not isolated. So I wanted to respond to that question of, how do we make sure students are socializing in a safe way in terms of combating that isolation. So I think for the students as well as the parents and family members on this call, know that we have been hearing from students about that sense of isolation, and we want to think about how our programming and events can really address that. So our basic pillars as we think about programming for our students in the spring is really going to be based on affinity building, relationship engagement, tradition building, as well as creating large but also smaller, intimate opportunities for organic ways of students to come together. In a moment and in a time of so much uncertainty, what our students have appreciated this semester that we want to continue is offering a menu of programs that is offered on a routine basis, that students know will happen. Our trivia night happens every Wednesday. My programming board folks might say I've got the day wrong, but I know we have a weekly trivia night. We do movies. We are trying to do weekly programming that students know will happen and provide some certainty as well as anchors for. I also really want to emphasize that any sort of decisions we make around student organizations and how they will operate will be done in partnership with our student organization leaders. They have been great partners this fall, and I know that they will continue to challenge us, but also to really tell us what they need. Having said that, again, I think we anticipate that a majority of regular student student organization activity will happen online. Weekly organizational meetings, for the most part, will still continue to happen online. We know that we will have limited amount of physical space where students will be able to gather. We're going to leverage Hopkins groups as well as our room reservation system, which we are now able to actually sync up and really help student organizations identify events that they want to do in person. We already had a consultation model for our student organizations as they planned events, but we're going to really tailor that consultation model to really look at how and what activities are appropriate for in-person versus online. And we'll do that in coordination with our partners in facilities, in events and registration, reservation, security, as well as our student organizations. Some of our, we also know, and I think the students on this call absolutely know, that spring is the time for a lot of tradition building events. This spring will be the 50th year and celebration of Spring Fair, which is one of our biggest tradition building moments. And I think the question on a lot of our students' minds will be, what will Spring Fair look like? What will the junior or the senior class council events look like? We have a lot of those events that happen throughout the spring. The first thing I want to say about those is spring will also be a time for us to reassess all of our operations. And I think our public health experts will really help us to think about, where are places where we can be more flexible and where are places where we need to pull back. So we are going to listen to the guidance provided by them as well as the university. We are determined to host these big affinity building tradition events, but do so in the ways that are, in accordance to the public health guidance. We are hoping that a large part of these events will still happen in the virtual space, but we're trying to think creatively about, how do we do outdoor events like a spring fair, where we can have separate isolated stations that provide folks some in-person engagement. We will be hosting once again our Student Organization and Involvement Fair, SIF, as our students like to call it, or maybe it's just me. It happens every semester. We had a successful student involvement fair in the fall online, and we will continue to do that online for the spring as well. So there are going to be some events that we will continue to offer online, and then again work with our student organization leaders to figure out what events make sense to have an in-person component. There will be a lot of events that we will partner with student organizations and host ourselves that may be more of a pick up and do an activity in a virtual space. We are currently thinking about an event, during the holidays where people can pick up ingredients to make a dessert. And so we may do a lot more contactless pickups. Succulents are a big hit with our students. We may do a pick up or make your own succulents. So we're thinking really creatively about events and programming that it requires students to maybe come and pick up something versus hanging out. I also want to emphasize, because I know travel has come up in a lot of different ways during this town hall, as it pertains to student organization sponsored travel. So if student organizations who have been going to competition, whether it's the Bhangra team or the debate team, we will not be doing any student organization travel. Again, that is not essential. And once again, I think the philosophy is we are highly discouraging students from traveling, and that is consistent in terms of our student organization practices. So I do want to bring that particular piece up for you. I also want to talk a little bit about the role that our RAs will be playing on campus. We hope to have all, if not the majority of our RAs in our residential spaces to support the students that will be coming back in the spring. Your RAs, like your FYMs for those residential students, will be an anchor, will be the agent that will help build community. Our RAs, the 14 of them that are here this semester, shout out to you, because they are doing some amazing things in terms of supporting our students that are currently in our halls and taking care of building community. We are testing out how do we do small in-person programs in the residence halls and balancing needs for students in terms of study spaces, as well as places where they can just socialize and hang out. Even though January and February are freezing, and I personally don't like to sit outside, we are also really reimagining and thinking about our outdoor spaces. And Alanna, alluded to the tent, but we're also trying to think about ways we can help student organizations do some of their events outdoors. So we will have guidance on specific numbers, specific places. The last thing I want to leave you with is that student organization leaders will be invited to information sessions either on or by December 7th, so before they go into finals, where the staff and student leadership and involvement and our student engagement staff will be able to go in more detail around policies, practices, proposals around student organization and engagement. I will pause there. I know there are some questions around athletics, and I want to see if Alanna wants to speak a little bit around athletics and some of the conversations there.
Sure, thanks, Smita. So with respect to athletics, know that the Centennial Conference presidents continue to discuss the issue of athletics come spring semester. Know that athletics administrators, as well as the conference office, obviously athletics administrators across all schools in the conference, as well as the conference administrators, have put forth proposals. And those proposals include obviously a range of activity. The most aggressive do include fall sports competition in spring. So, note that unfortunately we don't have decisions as of yet, but there are multiple models that have been advanced. We actually have a meeting this week, but I expect that a decision around Centennial Conference athletics is more likely to come forward in the month of December.
Great. Thank you, Alanna. There were a couple questions, additional questions that came in regarding these topics. So one of them, Andy, going back to housing. Question on November 12th, will we know if we actually have a roommate or not?
Right. So our timeline is a little truncated in telling you that you have a space on campus. That's what you'll know on November 12th. And then we'll take the intervening time before December 2nd to really look at everyone's preferences and roommate information and try to work out the ideal situation for as many students as possible. So on December 2nd, that's when you will find out who will live next to you. The word roommate is confusing in this context when you have private bedrooms, by the way. So, who will you share an apartment with or a suite if you're in those housing buildings, or if you want someone to be your roommate, even in some of our other buildings where we don't have suites or apartments, we are going to work hard to have, if you mutually select each other, have you live near each other. So maybe down the hall next door. So it's going to take us a little bit of time to do that. So on November 12th, you'll know that you have a spot on campus. And on December 2nd, you'll know exactly where you are and who you'll be living around.
Great. Thanks, Andy. There was another question that had to do with, would off-campus students be able to purchase a dining plan?
Yeah, we're currently hoping that that's the case. We're looking at how the flow of the dining halls will go, and we're hoping to be able to offer that. We really need to prioritize the students who live on campus for their dining plans. So that's certainly something that we're continuing to hope for.
Great. And there were a couple of questions that came in just about the travel limitations that we're putting in place. How will enforcement take place, and how would students have be expected to register for travel? Alanna, do you or?
Yeah, so obviously this is a process we're in the midst of building out. So appreciate that as far as registering your travel, there will be basically a technology intervention, or I don't know if it'll be a website or an app just yet, but you will basically be asked to kind of load your travel information into a system, which again will allow us to facilitate kind of your re-entry to campus. So more to come on that. I'm hopeful that we'll be sharing kind of the specifics of that registration process in December. As far as the monitoring of travel, I'm going to just kind of go back to Stephen's opening comments. We are hopeful that all students, faculty, and staff really embrace the idea of a campus-wide compact, where we're really committing to one another to do the right thing. I can tell you, we are not going to have staff running around Charles Village checking on who's running to a train station or an airport or any other kind of transit locale. We're really kind of imploring our students to do the right thing. And again, we're not asking them, they're not asking for permission. We're just really hopeful that they'll only travel when it's essential, and they'll choose to register that travel with us. So I'm hopeful that they just choose to be good community citizens. And that's, again, we're going to have a lot of compliance pieces that we need to manage through this process. Personally, I'm much more concerned about the compliance of twice-a-week testing for our undergraduates, that our bandwidth to really proactively manage who is or isn't telling us the truth around our travel plans is somewhat limited. So I am going to call upon people to ideally just do the right thing. We're not looking to blockade opportunities for essential travel. We really just we're really just hopeful you're good partners in this.
Thanks, Alanna. And, you know, I know other institutions have, you know, different approaches. This is the approach that's certainly been endorsed by our student advisory committee, you know, who have worked hard to, install a sense of community and commitment to this. And as I said at the beginning, you know, this I think has been embraced and recognized by other parts of the community as well. And so, you know, people want to make sure that if we are able to come back, we'll do so in a safe manner. Let me turn to Tom McDermott to say a few words about tuition and financial aid. Tom?
Thank you, Stephen, and good afternoon, everyone. My name is Tom McDermott, and I'm the Assistant Vice Provost for Financial Aid at Hopkins. There's just a few tuition and financial aid related items that I'd like to mention before we continue with the question and answer portion of the program. The first announcement is that undergraduate tuition for the spring semester will be at the standard full-time rate of $28,505. This amount is already reflected in current financial aid packages for the spring semester. Similarly, our assumptions around living arrangements for the spring already reflect an on-campus living assumption for freshmen and many sophomores, as well as off-campus living for sophomores, juniors, and seniors. Financial aid will work closely with students and the housing office to adjust packages later this month after the housing deadline so that aid packages are aligned with individual student living arrangements, including students who elect to stay at home. Bills for the spring semester are planned to be issued on December 10th. Another announcement is that there may be opportunities for students to work part-time on campus as we move forward with the plan to resume activities next semester. On-campus opportunities will be limited to those that can only be performed on-site, adhering to all social distancing, testing, and other university guidelines. If your student employment position can be done remotely, it should be. And we really want to limit on-campus employment to only those roles and positions that are required to be on-site and can only be done on-site. Last but not least, I just want to send a broad reminder to our students and families. If any of you, your financial circumstances have changed or you're encountering financial difficulty of any kind, please contact our office to request help. Students can request help at any time. You don't have to wait until the semester starts. The procedures are highlighted on the finaid.jhu.edu website. Help to families is always prioritized according to level of financial need. I'm going to go ahead and turn it back over to you, Stephen, for the rest of the Q&A.
Great. Thank you very much, Tom. And for all of you who have put in questions, please continue to do so, and we'll continue to address as many of them as we have time for. I want to circle back to a couple of questions that came in regarding some broad issues. One of them had to do with undergraduate students doing research at the hospital starting in spring. John, do you want to talk about that?
Sure. So we understand that one of the unique aspects of a Hopkins undergrad education is the opportunities we provide for undergrads to do research in labs in the hospital and in other settings. And so as part of bringing undergrads back on campus, we do intend to open up lab experiences for undergrads in the spring.
Great. And that's university-wide, right? It includes down in East Baltimore.
Correct.
Yep. Great. There was another series of questions about just participating in in-person classes. So one of the questions asks about Peabody, right? You know, each school is working on their own plan for spring. Peabody is, subject to a variety of challenges given the nature of their activities, but they are planning to resume as best they can a certain number of in-person activities as well. John, I know, we've communicated with them about their different protocols. Do you want to talk just briefly about some of those protections that we've put into place?
Sure. So Peabody presents some rather unique challenges. Think about singers and wind instrument musicians, for example. And so we have worked with Peabody and have looked at evolving guidance from musician organizations throughout the country at varying levels through professional orchestras, and are instituting a series of additional control measures beyond the usual masking and 6-foot distancing. Just to give you a flavor for some of what we're instituting with Peabody, there will be special masks for woodwind players that have a slit in the mask so that such a instrument player can remain masked while playing. There will also be bell covers that have filters in them for wind instruments. The distancing will change compared to a normal classroom. The air turnover and filtration in the practice and rehearsal rooms will change compared to a normal classroom, and so on. So we are paying particular attention to the very specific and unique challenges that Peabody offers.
Great, thanks, John. Let me circle back to some questions that came in regarding health and testing. So there was a question about what kind of testing we're actually doing for students, spit tests or nasal swabs. Do you want to talk a little bit about that evolution?
Sure. So the very first tests out in the world, including at Hopkins, the sample was obtained via a nasal pharyngeal swab, or an NP swab. That is the one we affectionately refer to as the tickle your brain swab, where it goes way up in your nose. That swab is still what we're doing for medical management. So you have symptoms and you're getting tested. It's an NP swab administered by a healthcare professional. For all the other testing we're doing right now, which is the epidemiologic surveillance study and the mass testing of asymptomatic dorm students, it is a sample in the middle of the nose. Officially, it's called a mid-turbinate sample that is collected by the person themselves. So each person sticks the swab up their own nose rather than having a healthcare professional do it. It is done at our sample collection site under observation. So it's not like a kit is handed to a student and we wave goodbye to them and they go try to do it themselves. So this is all done in a controlled setting. For the spring, we are switching from a nose-based sample to a saliva sample. All of the processing after the sample collection remains the same. We're still testing for nucleic acid, not for antigen or antibody. We're still using PCR. The only thing that's changing is where the sample comes from. And those saliva samples in the spring will also be collected at one of our sample collection sites under observation. So even there, students, faculty, and staff will be supported in the sample collection process.
Actually, you mentioned sites. It's probably important to note that there are plans underway for multiple sites on campus.
That's right. So at Homewood, we'll probably have 5 different sites, so you don't have to come to one specific place on campus. It's whatever makes the most sense. We'll have additional sites at Peabody, at the Carey Business School, at SICE in DC, and of course in East Baltimore.
Great. There was another question about how students get their COVID tests. And I recognize not everyone may be familiar with all of the acronyms and apps that we're used to speaking about.
Let me take a stab at that, and then Kevin can embellish. So there's at least two strange words that we've mentioned during this town hall. The first is EPIC. EPIC is the name of the electronic health record that Hopkins uses. Indeed, EPIC is also the name of the company that provides this electronic health record system, and it's used by many, many hospitals throughout the country. Each student, and of course faculty and staff, will register in EPIC, and their test results will be returned in EPIC as part of their health record. EPIC has a feature called My Chart, which is the way that patients can get access to their electronic health record. And in this case, the way that students and faculty and staff can get access to the test results. And so as part of registering in EPIC, you'll sign up for My Chart, and you'll have a login and a password, and it'll enable you to access your COVID test results on an ongoing basis. So that's EPIC. The other strange word we mentioned was Prodensity. Prodensity is the name of a mobile app that you download on your phone or iPad or other mobile device. It's an app that we created here at Hopkins, but you go to the regular app store, you'll find it, you download it, it's free. And Prodensity is what you will use to do your daily health screen. Right now, it consists of 2 questions. They're yes, no questions regarding symptoms and exposure and so on. And that app will also talk to the database that has the flu shot results in it. And as we stand up the enhanced testing program for the spring, it will also talk to the database of mandatory testing so that every undergrad, for example, in the Baltimore area is supposed to get tested twice a week. Prodensity will know whether they have, and that will factor into whether on your mobile device you end up with a green pass or a red pass. And those green and red passes reset every 12 hours, meaning the daily health screen has to be done each day.
So,
Kevin, do you want to add to that?
yeah, I'll just say John did a great job of explaining EPIC and My Chart, and that's how students will get their test results. Please know we will be sending instructions and more details around how you sign up and how you access it, the My Chart. So know that that is coming. But I also want to just reassure folks that if you test positive, you will be able to see that in My Chart, but you will also get a follow-up call from one of our health professionals if you test positive. And again, they will advise you on next steps. There was some confusion about the flu shot. Stephen, if I can just quickly. So again, I really encourage people, if you have a Walgreens nearby you, to use the Walgreens voucher, which you can download from our wellness.jhu.edu site. And the reason we're encouraging you to use Walgreens is your records will automatically go into our system that you got that flu shot, and you will receive a confirmation. Takes about 2 weeks sometimes until you might get that confirmation. However, I do encourage you to still keep the paperwork just in case. If you get the flu shot outside of the Walgreens system, you do need to email your information showing proof of the flu shot to the health center. So not Prodensity, but you send it to the health center. The health center will manually then upload it into the system that John talked about. And again, you'll get a confirmation, but just know it takes a few weeks for us to download the information and then for you to get the confirmation.
Right. So anyone who got it on campus, right, they don't have to worry about that.
That's correct.
Yeah. So it's really not on campus, not at Walgreens, at some other location.
Correct.
Yeah. Great. Just going back to testing again, there was a question about whether they would get a NP test upon arriving for campus, or are we going to start with saliva?
So the plan for the spring is that all symptomatic persons referred for diagnostic testing for medical management will continue to get a nasopharyngeal NP swab collected by a healthcare provider as the basis for the test. But all asymptomatic persons who are simply part of our mass testing program will get a saliva-based test starting right away.
Great. And there was one other question about related to health and testing about monitoring waste streams and sewage from buildings. Do you want to talk a little bit about that, since that has come up previously?
Sure. So it has become fashionable at certain universities to test the wastewater coming out of dorms for the presence of the coronavirus. We are designing such a program right now. It is likely, but not certain, that we will be routinely testing wastewater across all 10 dorms throughout the entire spring semester.
Okay. Thanks, John and Kevin. There are a couple of additional questions that came in regarding student and residential life. One question about how does a student indicate that they want to be part of the campus community, but may be living off campus? Andy or Smita, do you want to talk about that?
Yeah, I can start. The easiest way to do that right now is to talk to our housing office. During this housing applications process, that is a really good place for them to start. That office, is really very interested in working individually with students who are seeing the experience as not something that they are comfortable with for a variety of different circumstances. And they can help connect them to the off-campus housing office. They can connect them to financial aid. They can really serve as a hub and also talk through, really what the on-campus housing environment will look like to maybe answer some of their specific questions. So housing@jhu.edu. Great.
Another question specifically about how likely will the library reopen? And actually, while we were on this call, we actually had someone from the library who wanted us to emphasize that the library is working hard on a plan to bring students back in a de-densified manner. Again, the protocols that we're putting across campus in classrooms, in labs, in library and other spaces will ensure that there will be proper spacing and de-densification to ensure that it's a safe environment. And I know the library is working hard on that. There's another question about, will students be able to have a limited number of visitors from within their residence hall in their dorm room? I don't know if Andy or Smita, do you want to address that? I guess it's not from outside the dorm, it's really within the dorm.
Yeah,
I'm happy to take a shot and then Andy can add. I think each of the residence hall spaces are different and all the rooms are different. And I think we're gonna, in the coming weeks, gonna take some time to think through, what does that look like? Most of our residence halls also have common areas in terms of lounge spaces. So we would want to encourage our students to meet with one another in those lounge spaces and not in their rooms. So we are in the process of really identifying what are the common spaces, how do we organize those particular spaces with consultation from our health and safety colleagues and have revised room occupancies. But our first stance will be to really ensure that we're providing some common spaces so that residents within a particular hall can meet one another in those spaces and not need to meet in their rooms.
Great. Another question about Nolan's cafeteria and resuming dine-in service next spring.
So we're planning to have Nolan's open. It's actually serving the small group of students who are living on campus now. It is, it's set up as grab and go. We've also added some of the Charles Market features, and we have had good success with the grab and go. What we're trying to work through is if public health guidance would allow it, a dining in option. But we would keep Nolan's open for breakfast, lunch, and dinner. Traditionally, it's only been open for dinner. So that is the big change along with the grab and go option for Nolan's.
Great. Let's see, I think, over the course of the last hour or so, we've addressed all of the questions that have come in. So barring any, last minute items or anything that I missed, from the panelists, I think what I'm going to do is just wrap it up. And let me thank all of both the panelists who participated, as well as all of you participating at home. We did try, our best to answer every question. Certainly open to continuing to receive your questions and feedback. You can give that through the website, covidinfo.jhu.edu. I'll remind you all that this session was recorded and an archive of the town hall will be provided on the web, as is the other 12 town halls that we've held. Until next time, and we will be continuing to communicate with you this way as more information becomes available. Please remember to keep adhering to good public health measures, wash your hands often, avoid close contact, maintain physical distance in public settings, keep wearing a face covering, and importantly, take care of your mental health and do take advantage of all of the university resources that are available to help you during this continued disrupted environment. Keep safe, and we look forward to talking with you soon. Thank you very much.